So having that experience for many, many years and also working with the same team, there's very little oral communication between us because we know the procedure so well and we know exactly what's going to happen and when it's going to happen. So I would say it's incredibly important.
Join us as we continue our series on the unique relationship between Garfield Medical Center and house medicine, your team in your fight against cancer.
If I'm a patient, if I come to Garfield Medical Center, it sounds like you're going to give me VIP treatment, that I'm going to have an entire team within Garfield Medical Center dedicated to, we're dealing with liver cancer, for example. Is that pretty accurate?
That's absolutely correct. And the beautiful thing about the team is that they are very specialized to not only what we're treating, but to that specific patient. So when our patients come to the clinic or where they come through Garfield because they have an acute problem, we like to take care of everything about that patient, not just the liver, not just the pancreas. Patients often come with heart disease, they have diabetes. They may have an infection because there's a problem with the liver, there's a problem with the pancreas. So it's my role to help the house medicine team to take care of the whole patient, not just that specific organ. So every person in the room has to be an expert, and that expert just isn't in their field. It is very specific to what they're taking care of. So for example, we've said liver resection a lot in this educational piece. It's important for the anesthesiologist to be very comfortable dealing with all aspects of the liver not working very well, what happens to the liver under anesthesia, what happens when the surgeons actually start to cut through the liver, not only the implications for inside the operating room, but also how is that going to affect the patient when they get outside of the operating room. So having that experience for many, many years and also working with the same team, there's very little oral communication between us because we know the procedure so well and we know exactly what's going to happen and when it's going to happen. So I would say it's incredibly important.
For me, again, as an outsider, I think of flying on a plane. It's important for me to know the pilot and the co-pilot have flown together, not just that they each have experience. For your team, this experience has got to be very important.
Absolutely. And not just that the pilot and the co-pilot have flown together, but that they've flown that plane many times before.
Very important. It's very important. One last question. A lot of people think when we're talking about the liver or cancer in general, it's for 80-year-olds, 90-year-olds. Is this true? Is it only a senior citizen issue, or do people need to be aware of this much earlier on?
Absolutely not. It affects very young people. Just yesterday, we operated on someone who was 36 years old.
36. So again, we get back to the idea of prevention is the best cure. If they don't start an early screening, they might not know. When we're talking about liver cancer, as I understand it, the symptoms might not really be clear.
In fact, not just liver cancer, but pancreatic cancer, gallbladder cancer, oftentimes the symptoms are far too late. And you come in when the disease has already progressed. So education is the first understanding, knowing what the risk factors are, and then seeking the right expert to help you find what are the steps that I need to take for prevention.
Well, thank you very much, Dr. Taylor. It's been a pleasure.
Thanks for having us.
I hope you've learned something. I certainly have. That you will know that you can get help here at Garfield Medical Center, working with the team here and with house medicine. It's a very unique relationship where you can get both expertise and individualized, customized care. Thank you for joining us.
Thank you.